Hi, I'm Dan Dunlop with Jennings. I'm a healthcare marketer, and congratulations to everyone at Interval on your 100th podcast. Chris, that's amazing. I've been asked to answer the question about what was the most impactful thing to happen in healthcare marketing in the last 4 or 5 years. And I have to say there are two things that come to mind right off the bat. I know everybody's going to say social media, so I'm not going to say social media. It seems to me that the professionalism that has come to healthcare marketing is a relatively new thing over the last 5 years, and I think it's been driven by the economy. As hospitals and health systems have looked at what they're getting for their marketing and how they're using marketing, they've started realizing that this isn't just about having a department that cranks out brochures and print ads, that this is potentially, and if done right, a strategic component of the operations of your hospital. So I've seen more of an integration between planning, strategic planning, and marketing, where marketers now are looking at ROI. They're not just order takers. They're looking at the potential contribution to the bottom line of whatever it is they're marketing or they've been asked to market. So when someone comes to them, the head of some department, and he or she wants marketing for his department, the first question now is, what is your contribution margin? Do you have capacity? That's a huge change in healthcare marketing, and I do believe it is a change that is much more prevalent over the last 4 or 5 years than it was prior to that. So I'm really excited about that. The second thing I would say is consumers' access to health information, and that is tied to the internet and social media for sure. But consumers have always wanted information about their health, and now they have unprecedented access to information, not just about health, but access to information about the healthcare providers, the physicians, the hospitals, the clinics, and their reputation and track records. But also they have access to other patients, other people, and other families who are going through the same kind of health crises or dealing with the same health issues. So they have this opportunity to share information and point each other toward quality information. Now, all of that access to information is both good and bad. There's the potential for some horrific outcomes because people are accessing information that truly isn't quality information. And I think one of the developments we're going to see in the next 5 years, and one of the things I hope we're going to see, is more of the development of an authoritative or set of authoritative sources online for people to go to for health information. Right now, people don't know where to go for quality information. So what I think will happen in reaction to that, because there's going to be so much fragmentation and so much information out there from so many different sources, I do believe there's going to be the development of true authoritative sources and certifying bodies where there's something equivalent to the Good Housekeeping seal of approval for health information. I think it's needed so people can trust that content and act upon it. I think that's essential, and I do believe that's the next step in the evolution of health content online.